Bismillahirrahmanirrahim. Wish you all a very blessed day. Today, my audience, my listeners, and viewers who are watching me and listening me, and from the Pakistan or any part of the world. Assalamu alaikum wa rahmatullahi wa barakatuh. Today I am here with another episode of Minds and Mugs Exchange with the amazing new guest from Paris, France. He is he was working as a director of public health, and nowadays he is enjoying his retired life. So let's meet together with Eric Triffin. Hi, Eric. How are you?
I'm very
Welcome to
well,
my
thank you. I'm sorry?
welcome to my show.
Well, thank you for inviting me. I appreciate it.
Oh, okay, thank you. So before moving to ask a question, I want you to introduce yourself to my audience so my viewers can learn and can know about you very well. Please, over to you, Eric.
Okay. Well, I was born in Paris, but I moved to the United States as a child, and have lived here all my life. I have been to probably 35 countries or so, including Pakistan, but that was in 1968, probably maybe before you were there. Uh, but I enjoyed my stay there. My father was an international economist, so we traveled quite a bit during his vacations from the university, and I liked his working style and his way of using words to connect people and to make things simple and clear. And he had a lot of persistence in doing his work. I chose a different line of work. He was an economist, and I thought numbers were boring. But then there I go in the end in my graduate degree at Yale University. I took epidemiology and public health. So that again used numbers to help create health. And that was interesting that was my goal, was creating health. And numbers were an interesting way to get there. Um, but I was a professor at the other local university, one of the other universities here, Southern Connecticut State University, for 30 years, teaching public health. And I also have had a restaurant with a group of people. We ran it together collectively by consensus. So my guru says to speak truth and feed people. So I've done a goodly amount of each. Maybe that's a good start. Um,
It's really very nice that you are a multitasking person. You were working in so many fields and with so many people. So I want to ask you that motivated you to pursue a career in public health, and how has your perspective on health evolved over the years?
uh, Good question. I I'm an eternal optimist, maybe a blind optimist, but I believe that in humanity and in positivity. So I didn't want to work for a corporation that might hurt people in one way or another, whether economically and, using economic advantage. Um, so feeding people was a direct way to Im- improve health one bite at a time, one meal at a time. But then I realized, one, if I wanted to see my family, I needed to, and they didn't work at the restaurant, I needed a better job that would let me get home in the evening. And so I decided to go into public health, and to affirm the public and health in my work, so that though neither of those could be negative. Uh, we love people and we love health, and so finding good ways to promote health was my goal, and I think I brought a different approach to that in my as a director of public health. Uh, and so I wanted to promote good exercise, good food, good stress management, good connectivity with other people so we don't feel alone or loneliness. One thing we all share is our loneliness, is our aloneness. But really, in that way, we are all one. We have all oneness with even in our aloneness. So I've been looking for ways to that show that we really are one, that we and to, as I think it was Einstein said, separation is an illusion. So that's what I've been, trying more and more to do, to share, especially now that I've retired and I'm not working with uh, the bureaucracy of City Hall and those kind of pressures. I can focus in my own ways, and I do love to dance as well. Dancing is one of my favorite things to do. Um,
Okay. So, very nice that you are doing so well in your life and you were doing so well. So, how do you think that public health priorities have changed since your retirement, especially in light of a recent global event like COVID-19 pandemic? So,
yeah.
please, over to you.
Well, we the global issues certainly become local very quickly, uh, but under President Bush, he wanted us to immunize everyone against smallpox because he thought maybe that Saddam Hussein would spread smallpox over the country, but I thought that was unlikely, unrealistic, and that he was really trying to rally people behind the flag with a false notion of fear. And it's called jingoism, to bring people behind you by making them scared. And so I, in fact, resigned my position as director of public health because I did not want to immunize people with a vaccine that was, I believe, totally unnecessary and had some dangers to it, but really it was unnecessary. And what I learned from that was first that the mayor who was my supervisor would not accept my resignation. He agreed with me and agreed with my perspective and said, we'll work around this, we'll make other arrangements, and you don't have to do something that's against your principles. And my father had always said, never take a job that you can't leave if you're told to do something you don't believe in. And there, that came to my life in reality. And so that was interesting. The COVID-19 is a very different disease than the one that I was working with back then, smallpox. So it was not pervasive, and it was really highly unlikely that it would spread or be spread because Saddam Hussein had a no-fly zone over uh, Iraq at the time, so he couldn't get here um, to disseminate the virus. Um, Anyway, it has become, I think people now realize that infectious disease can be a weapon or can be, it's a different type of danger than a fire or a sniper. The fireman can take care of a house on fire. A sniper, maybe the police can, take out the sniper. But a disease like that is an infectious disease can infect people. They may not even know it for a week or more. And then they go throughout their town spreading it, and it leapfrogs to more and more and more people. And then it gets out of control. So I realized that public health has a very important role, but it's less visible because we don't have a focal point where it's obvious that there's a problem. The problem is spread throughout a community, and we have to put our arms around anyone who is sick, test them, test their family, test their contacts, and try to contain the virus. And I think the uniformed services, the firemen, the police, did not appreciate what public health, the work that public health does, because when we succeed at doing our work, nothing happens. No diseases spread. We inspect restaurants to make sure that they don't have, that they prepare food properly and cook it well and clean it so that there's no risk of infection from eating. And so, but they did not really realize that until we had these events that brought public health into the picture. And that was interesting to see how we could connect to them better. And so I actually hired a fireman to help me with the programs we were doing. And really what we did was organize people, an emergency response group, but also in apartment buildings so that people would know who to go to on their floor in the apartment building to find out the facts. And so we knew to be with information, to be first, to be credible, and um, to be honest. So that was an interesting difference.
So you think that the people take it very seriously after pandemic, and now they are caring their health and their kids and the society as well, community system. How they change their lives?
Well, hopefully it doesn't change their lives, that they stay healthy and well and protected from emerging illnesses, and that they see that public health and following the protocols of public health is a good thing. And just the way when the fireman says get out of the house, or put in smoke detectors to so that you can catch the fire before it spreads, that those are that public health has its own ways of doing that with diseases that are far less clear than a fire or a bullet. And so we use good thinking and good heartedness to connect people and to have them care about each other and to spread contagions of caring instead of fear and hatred, or pointing the finger at somebody and saying they're bad, they're the ones causing our problem. um, I am not, I think we have handled COVID in a relatively okay way, probably better in other countries than we did here in the United States. My dog, uh, fine enough. Um, he's still a puppy. He's only 2 years old, and he doesn't like the competition from somebody else. He wants to be in the conversation. Um, Say hi, Shine. Uh, can't see him. There a little bit. There he is. um, but I love animals too, and I'm a vegan, so I do not eat animals or milk or eggs. Luckily, it's easy here to find alternative food, foods that are not
Oh,
that don't
good.
involve violence. Um, no, go on, Sean.
So, Eric, I want to ask how you have been joining your retired life. Tell me about your favorite activities and hobbies nowadays.
Let me see if I can move my dog to somewhere else. Come on, Shine, Shine. No, you be quiet. Go on, go on. Um, Here, now I got him. In here, come on. No, you go.
Their dog is not like to share his attention or intention with someone else. That's why he is
I'm
disturbing
sorry.
me. Yes.
I'm I'm back.
So, can I repeat my question?
That would
Can I
be
repeat
helpful.
my?
Thank you.
Okay.
Yes.
How have how have you been enjoying your retired life? Tell us about your favorite activities and hobbies nowadays.
Well, I have always danced throughout my life ever since I was a little child. So I have maybe more time to dance and be free and to have that kind of friendship and communication in my life through a visual art. And what I feel the dancing does, it connects the outside and the inside, that we hear music outside us and we look for the internal music inside us that that makes us feel in harmony with each other or with life. And so it acts as in a way, a training to unite opposites, to unite the external and the internal. Again, like that, to eliminate the separation. And when you're dancing, you are the music. You are one with the music. I think we've all felt that to some degree. To clap even to the beat it unites us across every separation that can separate us, whether it's gender or age or color or race. We all love music and can be united that way. And to see that and to know that is practical, is can be done, is maybe a generic way to train us to unite opposites, so that whether it's politically or emotionally or socially, to find a way that we can be one with everyone without to be one with everyone. So I do love to dance, and I've found a friend of mine said that when I speak poetry, and that I had never thought that way before, but she sort of gave me permission to speak more. And I believe that when the opposite of speaking the truth is not speaking the truth, withholding it. And you're doing exactly that, the opposite. You're training us to speak truth. If we have a good truth to share, let's share it. And that is exactly what you are doing with your interviewees and your viewers who listen to us and see us and hear what we have to offer or what our lives are like, and that we might have similarities between us that can unite us more than separate us. And that even though we start separate, here we are for a half hour being one together. and that is a wonderful dance. And so, if words can unite us, the words can we can dance with our words, and your questions can be a lead. Can be like a duet to sing together by being prompted by the music of your questions. That was good.
So
I like that.
yes, I really enjoyed it because that much I observe you while I decided that I can conduct an interview with you. So I start observing you, and I realize that you are using so vibrant colors, and what you are involved in very active social activities. So I think this is the reason that you are very happy while you are completing your 70 years of your life. So the connectivity and the happiness and the heart feeling is change your and internal feeling. Is it so?
Yes, I think so. That is part of why I do. I took your interview, and why I like to speak with people or to dance in public, and to I I learned something. I've been a vegetarian all my life and vegan, so no meat or dairy products or animal products for the last maybe 10 years. But even as a baby, I refused meat. And my mother allowed me not to eat it, which I didn't find out till I was 60 years old. I didn't meet another vegetarian till I was in college. Um, so what I did find just recently, because spoke to many heart doctors and nurses, I asked them, is squeezing the blood out of the heart like squeezing water out of a towel? And they agreed, yeah. And then I said, so does that mean that the right and left ventricles of the heart are giving each other a hug to start every heartbeat? They use every heartbeat starts with a hug, and you could see them smiling broadly under their masks, and they'd never heard it put that way before. And I said that comes in under the radar with a user friendly approach that isn't the white coat syndrome in a hospital, or scared of a doctor and what are they going to say. They say something friendly like that you've never heard before, but that makes sense. And to who doesn't need more hugs? And so if we can find ways to communicate that are that easy and friendly, that is what part of my goal. And I'm looking more elementally, like food comes all from sunshine, photosynthesizing with air, water, and earth to make chlorophyll that is the beginning of food for all life. So food and calories of food are really stored energy from the sun. And when we eat food, we have sunshine inside us waiting to come out. And the sun turned into a peach to attract me to eat it, so that it could see how it would what would happen when it came out through me in a new way. And whenever I move my arms or even my lips, I'm releasing and freeing stored sunshine to shine again in a new and unique way that the sun has never shone before. And that's the kind of elemental truth that I think we all need to hear. And I've been saying it to it took me 70 years to figure that out. And so I've been telling everybody, even the
Yes,
person
exactly.
next door.
And
Um,
I think that after the retirement, you are still working on public health by your activities, by your colors, by your friendship, by your connectivities. Because I I think that these all things are connected with the public health and our mental health, our physical health. So that's very amazing. That's very great. I'm really, told you before that I am a very good learner. And I want to learn from you so many things because I am observing you very from last 2 months. So my last question is from you that what advice would you give to young professionals and professional to considering a career in public health and insights?
A career in public health and what?
Insights.
Insight. Oh, uh, well, again, I think go elementally, and that look for things that connect us. People want to feel connected, and when they feel alone, that they don't, you don't feel healthy, or you don't feel like you have a purpose in life. And to be able to connect to other people and care about other people gives us a purpose in life. So if we can find ways to do that, my father used numbers to unite the European currencies into the euro. And he always said, if you buy your bread from me, I buy my butter from you, we won't go to war. And I realized that he was using numbers to create trust between people. And the currency was actually the flow of goods and services between people and eliminating barriers to that happening. And I think numbers can do the same thing in health to unite people, for them to understand that our feet touch the same earth that 16 billion other feet touch. And that's only the human feet, not counting the ants and the antelope and the dogs and cats too. Uh, so that what unites us, we all breathe from one sky. We're all like alveoli on the lung of the sky, being breathed by the sky. So we have to take care of the earth. We have to take care of the air, and we have to take care of the water. We are 60% water. So if we can see the ways that unite us, that we are flexible and fluid because we are 60% water, we can adapt to all different environments the way water does. And sometimes we can be as wonderful as a cool drink on a hot day, but we can also be as hard as ice. And ice can break stones apart, but we can be that firm too. And we realize with real eyes those qualities because we are fluid and flexible and adaptable. And sometimes, and when we take a hot bath or swim in a lake, it's a wonderful feeling that we internalize and that we can share, and that you gives us, like the air that we breathe, the same air that Allah and Buddha and Jesus exhaled, and the dinosaurs too. So that I told the lead singers I know, I said, your in-breath is as free as the wind, but when you return it to the sky with a song in it, how wonderful is that? For the sky to spread the music throughout the world, in whether that's real or not, it is that they exhaled with that sound. And so we can share in similar ways and know that we are one, and that we feel better connected than alone. So I think that's what the
I enjoyed a lot. This is very fulfilled answer, and you are very explained very well. So I am really very thankful to give me your precious time, and thank you again. And I wish that I will connected you with you to learn more about the humanity, about the health, about the connectivity. So that is for today.
let me
Soon we will back. Yes, you are
one more
saying?
thing. The fifth
Yes,
element, air, earth, water, and sunshine.
yes,
The fifth one,
every,
I think, is the present
yes,
moment. and that listening is what you are
Listening.
doing to unite us,
Exactly.
to teach us to listen.
Exactly.
And love is always the answer.
Yes. Yes, exactly. Love is the always the answer. So that is for today. Soon we will back with a new exciting guest. Till for the next time. Bye bye. Allah Hafiz. Thank you, Eric.
You too. Bye bye. Much
Thank you.
love. Thank
Bye
you for
bye.
thank you for your work, and especially for uniting